For most people, talking about cancer is hard. It gets harder still when it is of a type located in, well, shall we say, sensitive and private places. But the disease doesn't differentiate on that basis, and we won't either. Particularly as we're joined by two people who are not shy about trying to get men, in particular, past their reticence on this tough topic. So we welcome Sean Paul Thompson, a men's healthcare advocate, creator of the fundraiser The Saline Ball, and a former testicular cancer patient. And Warren Kotler, a volunteer with Rethink Breast Cancer, who is living with breast cancer. And I welcome you two guys here to TVO. You I'm meeting, I guess, for the second time. I met you once a long time ago, briefly. You I know really well. Let's do full disclosure here. Your sister, Leanne, is a producer on the agenda, which is how we know each other. And I'm grateful to both of you for coming in and talking about something that far too many men don't want to talk about, which is why we are going to have this conversation. Sean, we're going to go back and forth here and just get everybody's stories on the record here. How old were you when you were diagnosed with testicular cancer?
Well, it was around the time of my 35th birthday, so it was not a very nice present, but that's when I learned the news that I had testicular cancer.
And what was the first sign that something was wrong?
Well, my right testicle started to shrink, so it was noticeable for me. I went from the size of a walnut to a grape. And the texture felt very different as well. So I was proactive at that time, and I went to my doctor, and I said, there's something going on here, can you help me out?
And what did you find out?
Well, he sent me to ultrasounds, and then after the ultrasound, I was sent to Sunnybrook. I thought it was just a reading of the ultrasound, but I got a handshake from a doctor who said, by the way, I'm an oncologist, and we think you have cancer. So I was in shock, obviously, but after that, it was immediate, and I had my right testicle removed.
There are all kinds of reactions to the news that you have cancer. There are, I suspect, even more difficult reactions when it is in a part of the body that people just don't like to talk about. How did all of this affect you psychologically?
Well, psychologically, I was already struggling with some men's issues, my masculinity. I had struggled with my sexuality. So
let's just say you're a gay man.
I'm a gay man.
Okay, there you go.
And it had been a struggle for me. So the fact that someone was now removing a big part of my masculinity, it was very psychologically challenging for me because I'd already had issues, and then a part of my body was being taken away, and soon I would learn another part of my body would be taken away. So
this felt like piling on in a way.
It was piling on, but for me, I became a bit of a warrior because I wanted to get to the root to it and put the puzzle together as to how I could be a bigger and a better man.
Gotcha. Warren, we know all about breast cancer because it is one of those things that occupies a great deal of our bandwidth, an appalling disease that too many women have to deal with, but very few men deal with it. How did you find out you had it?
I was in the shower one morning, and I'd noticed there had been a change in the texture of my left breast. I thought, sounds a bit odd, or sort of feels a bit odd. I've always been very proactive in terms of my health. When I think there's an issue, I have no problem to go to the doctor. So I went to the doctor, and he sort of scratched his head. Yeah, male breast cancer, very rare, but let's just be safe. We'll send you for an ultrasound right away. So within 24 hours, I had an ultrasound. And a day or two later, I was going to California with my daughter for a week trip for her graduation. And he said, don't worry, unlikely we're going to call you, and if we do, it's just because we have to follow up on something. Having dinner in San Francisco, I look at my phone, I see it's my doctor. I excuse myself from the table. I don't really want my daughter to hear this. And they say, you have to go for a mammogram right away.
A mammogram?
A mammogram. I'm in California. When are you back? Monday, midnight. We'll book you 7 o'clock Tuesday morning. So at this point, I'm realizing something is up.
They want me in fast. That can't be good.
I land. I go for a mammogram. I'm escorted into a room. And I look around, and very clear, one is not like the other. 12 women and me. Under any other circumstances, I'd be very happy.
Not those circumstances.
Not those circumstances.
Let me just send you back for a second there. You say, that, I mean, for women, they tell you, you know, self-examine, look for lumps. Is that what you found?
I found a lump.
It was a lump?
It was an absolute lump about the size of an almond. Distinctly, clearly, a lump. Absolutely.
Getting a mammogram, then. What was that like?
I sigh. I'd heard stories from my mother, from my sister, other female friends. Men don't have a lot of tissue, or at least I certainly don't. And you're brought into a room and you're pressed up against this plexiglass and you're pancaked and you're up against it and they're telling you to hold your breath, and it's excruciating. It is absolutely excruciating.
So more than just unpleasant.
Oh no, it's excruciating. And they're trying to take flesh from wherever they can to push it into this mammogram, and they're telling you to hold your breath, and I can't breathe anyway, it's so painful. And just as they're about to take it, it presses a little bit more. Procedure's over, you're happy it's over. We'll have the results within a couple of days. I got a call saying, we'd like you to see a breast doctor. I thought breast doctor sounds a bit odd. I Googled the doctor, surgical oncologist. I see where this is going. My sister Leanne came with me to the appointment. The short version is, sorry to have to tell you, but you most likely have breast cancer.
Now, when women hear that, the next question ends up being, you know, what are we going to do about it? May have to take off the breast, may have to do something less invasive. What is it for men?
No different. The conversation quickly went into, well, it's going to take a year off your life. We'll start you on chemo and the radical mastectomy. And I said, oh, like pictures I've seen, scar running across, like, yes, we'll do the radical mastectomy.
But yours was even worse because your cancer spread.
I then discovered it spread.
To where?
To my spine.
And what did that mean?
I had, subsequent to that appointment, it's a normal protocol, they scan you MRIs and CTs, and it was discovered on 2 of the vertebrae, 2 lesions on my vertebrae. So that by now it was end of November, so this all happened a year ago now. I was asked if I was experiencing pain, could I move my legs? Didn't have any pain, could move my legs, no difficulty whatsoever. A week after they brought it to my attention, I started to experience pain, but I could still function. December 26th, I was out Boxing Day shopping with my brother who had flown in from London all day, walking around, was in pain, manageable. December 27th, I could not move.
Couldn't move?
Could not move.
Couldn't get out of bed?
Couldn't get out of bed. I then subsequently managed, under great pain, to get to the hospital. I saw my oncologist. He said, you have to go to emergency right away. Had an MRI, and they said, your back is broken in 2 places. So the cancer lesions had eaten away at the vertebrae, and the back had collapsed.
So they operated on your back?
I was admitted to Toronto Western, where the top neurosurgeons are. Unfortunately, it was in between, it was now coming into New Year's. The top guys are on holiday. And you don't really want the B team working on you. So every day it was, let's wait to see if we can assemble the team. And every night at midnight, no eating, and if the team hasn't been assembled by 1 o'clock that afternoon, you could eat again. Finally, January the 3rd, 2 hours notice, you're going in for surgery.
Okay, well, here we are a year later. They told you it would take a year out of your life, so here we are almost a year later. How are you feeling physically?
Fantastic.
Really?
I feel fantastic. It's a very strange feeling for, I know it's a bit odd for me, but when people hear that, they look at me and I don't sort of present either as a stage 4 cancer patient, nor as someone who's had their back completely rebuilt and I'm held together by rods in my back. I feel fine. I live with cancer in the same way I live with arthritis in my knees.
Now that's an interesting choice of words, because I hear some people say I am a cancer survivor. You don't use that expression.
I don't.
Why not?
I don't feel I'm surviving. I'm living. Cancer disease, in my case, it's a chronic disease. It will most likely come back. I live with arthritis in my knee. Arthritis is a chronic disease. I live with arthritis. I live with cancer. And I choose to live.
Sean, how about you? How do you describe what you've been through?
Similar to Warren, I don't feel sorry about myself. I accept it. I'm authentic like you are about it. I speak out to people about it. I try to inform people. even to your point about the mammogram, I've had a mammogram too because they check you for everything when cancer's in your body. And yes, it is a painful experience, but men, get out there and get it done if you have a lump. Or it's that action and that early detection that really, really saves lives. There's so much shame associated with it.
I completely agree with you.
And
Men are not
embarrassment,
accustomed.
yeah.
Women are programmed, self-examination. As they grow up, they'll have a gynecologist, they have a doctor. You know, I think men from late teens, perhaps into 30s, don't typically think about themselves from a health perspective. We're great, we're healthy, we're invincible. There's a greater pattern of seeking medical advice and attention, I think, from women. Men need to do more.
And I think there's a certain shame that's associated with it. And it's also, I felt it with my sexuality. So then when I learned that I had testicular cancer, I thought I'd done something wrong again. I was getting whispers from people, don't tell anyone, don't tell anyone. And I was like, I want to tell other people because it affects kids can hit you at 14. I got it at 35.
But you know what? If you had liver cancer or if you had prostate cancer, nobody would bat an eyelash about that. But there's something about testicular cancer, or for that matter, male breast cancer, that makes people pause. What is that?
It's the fear of losing your masculinity, that you're not man enough. And to even say the words that you have breast cancer, I have to give you a pat on the back for that. It's hard. It's very difficult. I have to say you have bigger tits than I have bigger balls. Like at this point, seriously, I live through this with a sense of humor. I have to say that.
There must be, humor is such a
humor is vital to
part.
This journey. Because you're talking about balls and you're talking about
absolutely.
Penises and boobs, and it's not in the fun way like you referred to earlier.
You got, I mean, since we're on the topic of humor here, you got a pamphlet sort of outlining all of the stuff you're supposed to do, which, you know, I see you even starting to smile now as you think about it. Tell us what was funny about it.
There's lots of material that has been handed to me. Virtually every test that I've gone to, I can't answer 40% of the questions. I'm not menstruating, ovulating, menopausal, perimenopausal. There's definitely no chance of pregnancy. And after my first appointment with the surgical oncologist, I'm handed a pamphlet, A Woman's Guide to Breast Cancer.
What do you do with that?
Thanks.
Can I infer from that you think there needs to be a bit of a change in the literature provided to breast cancer patients?
I'd like to see more of a change in terms of inclusion. The numbers speak for themselves. Women, by a long margin, will be impacted far more greatly by breast cancer. My understanding is it's about 11% of women, and it's 1/10 of 1%.
Of men?
For men.
Who will get it?
Who will get it. I also understand those numbers are increasing. I don't know why. Environmental, what we're putting in our bodies. Male breast cancer is definitely on the increase. It's small, but it doesn't strike me as being too difficult to talk about breast cancer as a disease as opposed to women's breast cancer. Everything really revolves around women's breast cancer.
Well, to that point, when you see the color pink these days, you think cancer, you don't think bubble gum. And
Correct.
I've got to give credit to women. Women have been leading this, and men need to kick up their game. They need to man up, and just get out there, get out of the shame, the embarrassment, and talk about it. Just women have done a better job. If men came forward and started speaking about it, it starts with speaking with someone, whether it's your nephew or your brother or us speaking today as men. It's important, and in environments where men will speak to each other, whether it's a bar or the gym or something where it's comfortable. Because I've been approached with my advocacy with one-on-one where I get a random call from a customer saying, I have a lump and I feel like I'm doing a drug deal or something. But they're so ashamed, they're not even telling their wife, they're not. So it's a problem that men are not speaking out, and we have nothing to be embarrassed about.
I completely agree. Everyone is entitled to how they deal with their particular diagnosis.
Right.
I choose to be very vocal. I talk about it. I'm not afraid. I post on Facebook. I'm happy to get out. If I can, I'm happy to volunteer my time and energies to advocate for breast cancer. The Rethink Breast Cancer people that I've done just a little bit of work with, they advocate educational programs and initiatives for younger people, age 40 and under. People have to learn, they have to understand, and not to be afraid to look, examine, and go to their doctor and say, I think I might have a problem. There's no shame in this.
There isn't, but you two are, in some respects, spitting into a wind that has taken millions of years to get here. And I refer here to the fact that, I mean, men are just not good in general about talking about deeply personal health information, not so much with their doctors, but certainly with each other. So you're asking men to do things that is not in their nature and makes them deeply uncomfortable to do. How do we get over that?
You take a risk. I think the first, what you just said about seeing a doctor, if you feel more comfortable with a doctor and you have a problem, well, get in and see a doctor. I have a very good friend of mine who, 18 years, he thinks he's never been to a doctor. And he's on top of the world. He makes a ton of money, has a great family, et cetera. But who knows what's going on inside? This is just not, this whole month is about health issues, men's health issues. So just, if you're not comfortable talking to someone, then talk to a professional.
How did you get comfy talking about this?
I've always been comfortable talking to people.
Okay.
I've been comfortable with myself. It's nothing to be ashamed of. And I think I'm dealing with it in a fairly positive, strong way. And I hope to be able to continue with that. Cancer will be with me forever. Stage 4, it's in you. It's not going away. There is no magical cure.
So you have cancer in you right now?
I will live until I die with cancer. Stage 4 does not leave you. Correct. Years ago, doctors didn't tell their patients the bad news. My great uncle was a doctor to the Bronfmans, and Sam Bronfman had cancer, and they decided, let's not tell Sam because he really shouldn't know, and he'll live a happier life. That doesn't happen today. Doctors inform their patients. You have to have the information. It's not something to be afraid of. And I think if we can get the message out that it's okay, it's not something to be ashamed of, afraid of, shy about. I think if you look back at the AIDS epidemic of the 80s and the fear associated with that now, versus how AIDS is looked at now, a lot of that, I think, and you can certainly
been a
talk
shift, yeah.
to this much more than I can. There's been a great shift. And I think for men's health, there has to be a great shift. Prostate cancer. A lot of men, and I know a lot of guys, they're not crazy about going to the doctor.
But a lot of it comes down to early detection. And I think if you relate to men in a way, like I was told, because I came so early about my testicular cancer, I had a 94% chance of beating it. So if I tell a friend, you have a 95% chance of winning at that sports thing or at a gambling thing or something.
Those are good odds.
Just relating. Those are pretty good odds. Those are odds I'm going to take. 94%.
We found out from Warren what his status is right now. He is living with cancer. It is still in him. What's your cancer situation?
I am fortunate. I am cancer-free. I have been for a number of years. They followed me very closely.
How many years have you been cancer-free?
It's my first surgery. Well, I had both of my balls removed. It's easier to say balls. And I was pretty radical. I could have had radiation on my other ball and tried to maintain it and keep it, but there were precancerous cells there. So I just thought, I'm going to push, and I really had to push to have that other one removed.
But you didn't want kids, right?
I didn't want kids.
So that was not an issue for you?
It was not an issue, but it's still, it was a psychological issue because once again, I felt like I'm okay. But I felt like a eunuch or something, you know what I mean?
But you're cancer-free now.
I'm cancer-free.
For how many years?
It's been 15 years since, and I've been cancer-free. They monitored me, but 15 years.
So do we say you're cured?
I would say I'm cured, but I'm always in charge of my health, and I'm always checking. They check you a little closer in the beginning, but at a certain point, they kind of give you a handshake and say, we're comfortable that you're cancer-free.
Warren, let's just finish up on this. Our generation, as we've established, is pretty miserable about talking about these issues. What about the generation coming up behind us? Our kids' ages, for example? Are they better at this?
I have 3 children. I speak to them very openly about my situation. I encourage them to see doctors. I have a very good rapport with them, and I think their experiences will be very, very different. And if there's anything that I can impart on them because of my experience and that they can impart on their friends, I do see a shift. They're not afraid, certainly, to talk to me about health issues. I have a son and 2 daughters. My daughters talk to me pretty much about most health things, and they're not afraid to speak up when they think it's necessary. So I do think there is a shift similar, my parents' generation and their parents' generation, to my children. I do see a change.
And your son?
My son is healthy. He's great. He talks to me.
He is open with you about these kinds of things.
He's open with me. He goes to doctors. And if I see that there is a hesitation, I'll provide some careful encouragement and guidance. At this stage, we can only provide guidance to our children.
Well, and I think the message, too, is that both of us are living in a healthy, positive way. I have a normal sex life. People think it's the end for them, always. I have a normal sex life. I'm happy, I'm comfortable. I had replacement saline balls put in. They're better than ever. Like, it's not such a doom and gloom thing. And if we could just get that message across to people that...
I think that's very important.
Because you're living an amazing, positive life.
I water ski, I'm sexually active.
Not while you're water skiing. Well, that would be really interesting, I think. I don't know.
And there's the humor again.
See, it's always got to be there.
Yeah. Guys, I want to thank both of you for coming in and sharing your stories with us. I really think these kinds of conversations move the yardsticks along and help us understand it all a lot better. Sean Paul Thompson, Warren Kotler, really good of you to join us at TVO tonight. Thanks so much.
Thanks,
Thank you very much.
Pleasure to be here.
Thank you.
Help TVO create a better world through the power of learning. Visit TVO.org and make a tax-deductible donation today.